Medical patients in the St. Louis area are being hounded by medical equipment companies trying to convince them to ask for equipment they don't want or need.
And the money to pay for it is coming out of your pocket.
So I think that sounds like fraud, and it sounds like an abuse of the situation, abuse of the patient.
A local doctor raises concerns to Congress this week about possible Medicare fraud, but her experience is just the tip of the iceberg of a multi-billion-dollar problem. Russell Kinsall is asking some of those companies if they are cheating you out of your tax dollars.
You know what? Some of the biggest medical equipment companies did not want to talk to me today, and they didn't want to answer Missouri U.S. Senator Claire McCaskill questions yesterday when she held a hearing on Capitol Hill about Medicare fraud. Insight into this problem came from a Chesterfield doctor who grew concerned when a medical equipment company notified her that some of her patients wanted medical equipment.
And in fact, when I called my patients and asked them about it, they said, "Oh, Dr. Kennedy, they have been calling me and calling me. I told them I don't want the knee brace. I told them I don't want the back brace."
Dr. Charlotte Kennedy says Medicare patients are getting cold calls from equipment companies twisting their arms to request equipment. They're told, "Don't worry, it's free because Medicare will cover the cost."
Well, I'm concerned that many things are getting ordered and possibly signed off on that the patients don't want, that they don't need, and yet Medicare's billed for it. So it's, I believe, a fraudulent practice.
So I called some of the companies that she said are most aggressive.
I have some questions about your company's business practices.
Surprisingly, no one was available to talk about their tactics.
Actually, I'm just going to forward the information on to the person you'd want to talk to because he's not available at the moment.
The cost to Medicare and ultimately taxpayers for extra unnecessary medical equipment could be billions of dollars. Dr. Kennedy was so concerned that she contacted Senator Claire McCaskill, who held a hearing in Washington this week to try to get some answers.
I knew that this was money that was going out the door that we can't afford in the Medicare system. I mean, our debt is really about our health care costs. And I want to hold on to that Medicare program for all the seniors. So we've got to find the waste and the fraud, and this is a great place to start.